The degenerative symptoms of Parkinson's can cause great stress and frustration for the person experiencing the symptoms and the family as a whole. Hanging with his grandmother was something that Jermaine always enjoyed doing. However, Jermaine has started to notice that his grandmother's hands and legs are starting to shake uncontrollably. Jermaine has also noticed other symptoms that his grandmother is displaying more recently, which include paranoia and his grandmother seeing things that aren't present. Parkinson's disease. Parkinson's is an illness that affects the central nervous system. It has a direct impact on the brain and the spinal cord and usually only affects adults. More specifically, this disease damages a group of nerve cells in the deep part of the brain called the basal ganglia. These nerve cells make and use a brain chemical called dopamine to send messages to other parts of the brain to coordinate body movements. When someone has Parkinson's disease, dopamine levels are low. So, the body doesn't get the right messages it needs to move normally. What causes Parkinson's? Experts agree that low dopamine levels in the brain cause the symptoms of Parkinson's disease, but no one really knows why the nerve cells that produce dopamine get damaged and die. Some experts think that a change in a specific gene could explain why a person develops Parkinson's disease. Others think it could be something in the environment that causes the damage, such as pesticides or other chemicals. No one knows the exact cause of Parkinson's disease, but we do know that it has been around for a long time. In 1817, an English physician named Dr. James Parkinson called it shaking palsy. Eventually, the disease that Dr. Parkinson first described was named after him. Who gets Parkinson's? About 1 million people in the United States have Parkinson's, and both men and women can get it. Symptoms usually appear when someone is older than 50, and it becomes more common as people get older. Many people wonder if you're more likely to get Parkinson's disease if you have a relative who has it. Although the role that heredity plays isn't completely understood, we do know that if a close relative like a parent, brother, or sister has Parkinson's, there is a greater chance of developing the disease. But Parkinson's disease is not contagious. You can't get it by simply being around someone who has it. What are the symptoms? The symptoms of Parkinson's disease include tremors or trembling. Shaking hands are often the most telltale signs of it, difficulty maintaining balance and coordination, trouble standing or walking, stiffness, and general slowness. Over time, a person with Parkinson's may have trouble smiling, talking, or swallowing. Their faces may appear flat and without expression, but people with Parkinson's continue to have feelings, even though their faces don't always show it. Sometimes people with the disease can have trouble with thinking and remembering, too. Because of problems with balance, some people with Parkinson's fall down a lot, which can result in broken bones. Some people with Parkinson's may also feel sad or depressed and lose interest in the things they used to do. The symptoms of Parkinson's disease appear gradually and get worse over time. But because Parkinson's disease usually develops slowly, most people who have it can live a long and relatively healthy life. Diagnosis and treatment. Someone with the symptoms of Parkinson's may be sent to see a neurologist, a doctor who specializes in the brain, nerves, and muscles. The neurologist may do some tests, including a brain scan and blood tests. These tests will not make the diagnosis of Parkinson's disease, but the doctor will want to make sure that there is no other problem causing the symptoms. To diagnose Parkinson's disease, the doctor relies on a person's medical history, symptoms, and a physical exam. If a doctor thinks a person has Parkinson's disease, there's reason for hope. Medicine can be used to eliminate or improve the symptoms, like the body tremors. And some experts think that a cure may be found in the near future. For now, a medicine called levodopa is often given to people who have Parkinson's disease. Called L-DOPA, this medicine increases the amount of dopamine in the body and has been shown to improve a person's ability to walk and move around. Other drugs also help decrease and manage the symptoms by affecting dopamine levels. In some cases, surgery may be needed to treat it. The person would get anesthesia, a special kind of medicine to prevent pain during the operation. Living with Parkinson's. As Parkinson's develops, a person who has it may slow down and won't be able to move or talk quickly. Sometimes, speech and occupational therapy are needed. This may sound silly, but someone who has Parkinson's disease may need to learn how to fall down safely. And if getting dressed is hard for a person with Parkinson's, clothing with Velcro and elastic can be easier to use than buttons and zippers. The person also might need to have railings installed around the house to prevent falls. If you want to discover the truth about Parkinson's that pharmaceutical companies hope you won't find out about, click on the link in the description. Subscribe to the channel to receive all new. Thank you for watching this video.